Hey guys, welcome back to my YouTube channel. Remember, I'm still your girl Cherry, and today I'm going to be telling you one reason why many people slump and die in the marketplace, at work, while driving, they'll just seize and all of that. Most times when in Nigeria, it's believed that when somebody slumps and dies from village, well, they can have their own point, but the most common cause of that sudden death, especially in an African man, is heart attack, high blood pressure. Many people don't know their blood level, their blood pressure level, and as a black, it's advised that from the age of 45 that you should start checking your blood pressure. Some people actually have high blood pressure way beyond this age, but if you're clocking 45, it's a must for you to check your blood pressure. Now, the most common thing that happens is that people will not know that they have blood pressure, high blood pressure, and high blood pressure is an over the time sickness. Yeah, if there's a high blood pressure, if you're having high blood pressure too, which is usually acquired from lifestyle, not walking around, sedentary lifestyle, smoking, living in an unhealthy environment, um, obesity, that's eating too much, then eating fat and oil food, then so much salt in the system, a whole lot of other all these things, lifestyle can cause the second type of high blood pressure. The first type is the one that is from birth, that you really cannot do anything to. The only thing you have to do is try to control it, and these ones come earlier in life, earlier in age, but this acquired from usually 20. That's when people start living this kind of lifestyle, yeah. So they and then they get a job that makes them sit one place for a very long time, so they develop high blood pressure without knowing. Do you get? So on a very one particular day, there's this case that we had in the hospital sometime. This man was rushed into the hospital. He was having a heart failure, heart attack. Guess what happened? He just finished having sex with his wife. That peak of excitement got into his blood, and and he did not know before then that he was having high blood pressure. So when someone is having high blood pressure and doesn't take this drug, for now there is no particular treatment for high blood pressure. What people have is control, to how to control this high blood pressure. So when this particular man that was rushed to hospital around 5 a.m., he was the history was that he was having sex with his wife, and then his wife noticed that he was jerking and all that, so she quickly called for attention, and they rushed down to hospital. Now, before then, this high blood pressure has been rising, and he doesn't know. So at that particular point, when he experienced the peak of excitement, the thing the crisis started. Now, some people experience their own when they are stressed. Like one woman, a cousin, a friend of mine, his sister died after she drove from Akure to Lagos. She was pregnant. Of course, there's a blood pressure that comes with pregnancy. She was pregnant, and then she drove herself from Akure to Lagos. That stress peaked, and then she immediately she entered her house. She slumped and died. If you notice, some people actually, when they get to work, they slump and die because most likely there might be pressure at work at that moment, or something, pressure at home, pressure at work, pressure everywhere, so it gets to their brain and the blood vessel bursts, and they slump at that point. When they slump at that point, most of them don't die straight up. Most of them just need like a CPR, a cardiopulmonary resuscitation, to get them back on. But most Nigerians are not aware of this, so they just assume the person is dead. Or worse come to worse, they leave the person there for a very long time, so the person could die on that place before they take the person to hospital. But if anybody is well educated, maybe the person slumps and die, you do a CPR for the person. So in this video, I'm going to be telling you the early signs of heart attack, that this person or you that are watching me now, yeah, you might have heart attack. The early signs, let's watch. Remember to subscribe to my YouTube channel. My name is still Cherry, and I love you guys so much. And share this video to your friends, your family, your lover, on WhatsApp, Instagram, Facebook, and all of that.
When the heart does not receive enough oxygen because blood flow is suddenly interrupted, the heart muscle cannot pump properly, and the tissue begins to die quickly. About 735,000 Americans have a heart attack each year. However, only about 27% of people know all the symptoms of the urgency of a heart attack. Recognizing the signs of a heart attack and get to the hospital immediately can mean the difference between survival, irreversible tissue damage, and death. If you have any doubt about
Basically, the time of getting the person who slumped to hospital determines whether this person is going to survive, this person is going to
minutes
be
or
in
more, or go away,
vegetative state, this person is going to survive, this person is going to be in vegetative state, or this person is going to die. So once somebody slumps, if there's someone who is fully aware of how to do a CPR, the person can do it, or just quickly rush the person to the closest hospital. That is the better thing to do. So the first time is usually chest pain. Most people experience chest pain and take it. I'm gonna take paracetamol without doing a proper checkup with their hospital. Ideally, you're supposed to do a checkup in hospital at least once a year. A full body scan. Full body scan includes a CT scan, a body scan, abdominal scan, chest scan, your bones and muscles. Just check yourself at least once a year or once in 3 years. Some people say once in 3 years, but if for a dentist, you're supposed to see a dentist twice a year. But some doctors say, okay, come and do due to exposure to X-ray and all of that, do it once in 3 years. So at least you need to do a full body scan. Hello, go and do a full body scan. Check out all those things. It is not a God forbid bad thing or over my dead body something. It is prevention is better than cure. Yes, especially for people who have high blood pressure issues in their family. You need to check yourself regularly. So if you're not checking yourself regularly, you're just saying anytime you should come, and everybody can die. Some people say make such statements, but you can actually prevent a whole lot of things. Some people go as far as doing breast surgery, mammectomy, that's removing their breast because there's breast cancer in their lineage, and that is prevention. It is better than cure, or better than experiencing the death penalty of not taking care of yourself before time. So the first one is usually a chest pain, whether dull or acute, like sharp pain. Dull maybe over time and all of that. then
and come back later.
then another one is dizziness. Most people that have heart attack usually have dizziness, some sort of dizziness. And some people, for an extreme case, they might have swelling of the feet and face and hand. um Before this time, when they wake up in the morning, they have these swellings, but during the day when they walk around, it goes out. So they'll say it is the drug, or it's because this, is because that. Man, that's a sign of heart failure or heart attack coming. um Having a swelling on your feet, on your hand, on your face in the morning is a sign of heart problem. You should go see a doctor.
Check that the discomfort in the upper
Remember to subscribe to my YouTube channel. I'm still your girl Cherry, and here I am, a Nigerian doctor
area
teaching you
outward,
about.
causing discomfort in the neck.
So these ones are like deeper part of the stuff, like left arm pain, distal pain, and all of that. So basically, what you need to do is to check your blood pressure. I know that general hospitals these days, once you get there, no matter what the complaint you have, you must do your blood pressure test and BMI. BMI is basic mass index, where they'll check your height and use your weight to calculate it. So, but I know that the importance of knowing your blood pressure is as good as the importance of knowing that you were alive, because they said that there's some research that says that eventually every black man has a tendency to have a high blood pressure, and high blood pressure is a slow killer. You will not know that you are sick. That is just the worst thing. You will not know that you're sick, and you will not know what you're taking that is exaggerating or triggering all these things. But if you know by going to the hospital, going to the nearest pharmacy to check your blood pressure, then you will be well informed. And of course, if someone has blood pressure, hey, take your drugs. Just take drugs, that's all. And it to be controlled over time. Take original drugs and it to be controlled over time. That's basically what you need. But slumping and dying has a lot to do with high blood pressure. So thank you guys for today, and remember to subscribe to my YouTube channel and share this video to your friends and family. Bye.